Fillers with hyaluronic acid were the next big breakthrough on the market. Hyaluronic acid is a polysaccharide found in human tissue and is the main component of corrective tissues. Approximately 50% of hyaluronic acid is found in the skin. One of its key characteristics is that it can hold up to 1,000 times its weight in water, allowing for the skin's natural moisturizing. Injectable hyaluronic acid can be animal-based or synthetically produced. Since hyaluronic acid is the same in all species, no skin test is required for the animal-based products. Some hyaluronic acid has a longer durability than collagen, and it gathers water as it deteriorates, thus prolonging the result. Overcorrection is not required, nor is refrigeration. There are other substances being explored for fillers, including poly-L-lactic acid and calcium hydroxylapatite, among others. These are not so much dermal fillers, but tissue stimulators. Instead of replacing a component in the skin, such as collagen or hyaluronic acid, calcium hydroxylapatite is designed to stimulate new collagen production and tissue regeneration. Calcium hydroxylapatite lasts approximately 12 to 14 months, leapfrogging the previous durability records. The durability of the different dermal fillers first depends on their chemical makeup. Durability is also based on depth of placement, location, and patient's age. Another way to increase durability of a temporary filler is to use it in conjunction with Botox. Muscle movement degrades the filler and creates lines. Botox can help inhibit this muscle movement. Upper lip lines, glabellar frown lines, and crow's feet are areas that work well for receiving both treatments. For more information about Botox treatments, check out Aesthetic Video Source's instructional video on Botox techniques. Each product has specific indications approved by the FDA. However, it is ultimately up to you, the physician, to use your medical discretion in offering a product for off-label purposes. Ultimately, your skills as a provider of dermal fillers will come with experience. Consistently satisfying aesthetic results will require a solid understanding of the products and accuracy and skill in injection. Dermal fillers are usually injected into the upper to middle dermis, depending on viscosity and intended purpose of a given product. For example, some are designed for the upper epidermis, whereas others go deeper into the dermis or are subcutaneous for more significant folds. Placement depth is critical. Depending on the product, it will be lumpy or cause blanching if too shallow. If too deep, it will absorb too quickly. You will learn how to determine dermal layer by experience and feel. The dosages depend on the product and injection site. The placement of the injection, angle, and depth also vary, depending on the targeted area. There are different techniques for injection: threading, fanning, cross-hatching, push-ahead, and serial puncture. Threading involves injecting bevel down and threading along a line or wrinkle. Angle the needle at approximately 20 degrees. Variation of angle changes the depth of placement. When it is in the right plane, inject dosage as needed, while withdrawing the needle along the line to create a ridge of material. Depending on the depth of the wrinkle, 2 passes lateral to each other may be needed. With fanning, you insert the needle and inject as you would threading. The difference is that you do not totally withdraw the needle, but redirect the position of the needle and inject a new line without withdrawing the needle. The injections are repeated in a fan-shaped area. Cross-hatching involves injecting in the same fashion as threading. Create a series of linear threads about 5 to 10 millimeters apart. Then create a second series of threads running at a slightly different angle in the same area. The push-ahead technique entails a series of injections next to one another, pushing the product ahead of the needle. This creates a plane along which the product can be deposited. Serial puncture involves a series of punctures to inject a small amount of filler along a line. Massage after injection is generally not required for hyaluronic acid fillers, but it is required with collagen. Massage with hyaluronic acid fillers will increase bruising. Gently press to ensure there are no bumps or gaps in the filling. For injections, use the thinnest gauge needle to minimize discomfort. There is usually a short-lived stinging or burning sensation from the product itself, particularly with hyaluronic acid fillers that lack any lidocaine and have more viscosity. This can be alleviated with a local anesthetic cream or injection, depending on the client's pain tolerance or injection site. Discuss this up front with your client to gauge their sensitivity. All cosmetic procedures carry risks. The best approach is to educate your clients and set expectations. Help set expectations with before and after pictures of other patients. Clarify that fine wrinkles may remain. Also, take photographs of them before and after to show them the difference that treatment provides. And have them sign a consent form detailing the results possible with dermal fillers, possible drawbacks, contraindications, and after-treatment care. Patients who should not be treated with dermal fillers include those with the following contraindications: pregnancy, lactation, product sensitivity, bone, tendon, ligament, and muscle implants, skin disease in the injection area, and abnormal clotting. With the bovine and autologous collagen fillers, also be aware of contraindications specific to the products: severe allergies, history of anaphylaxis, allergy to lidocaine or xylocaine, allergy to bovine or collagen-based products, breast augmentation, and bone, tendon, ligament, or muscle implants. Most side effects are mild and temporary, including hypersensitivity, granuloma, erythema, pain and tenderness, bruising, swelling, itching, and rash. General after-treatment instructions should include avoiding alcohol, exercise, and animated facial expression for at least 6 hours after injection. Touching the area should be avoided for 2 to 3 days, and exposure to sunlight should be avoided for 3 to 5 days.
Today I'm going to work with some dermal fillers. Dermal fillers have evolved from substances such as collagen or bovine collagen, which was created in the 80s and was formed from cow material, to substances such as calcium hydroxyapatite, which is a substance that's found in between bone cells. Today I'm working with a hyaluron. Hyaluronic acid is a substance that's found intracellularly and between cells, and it helps to support the collagen fibers that are underneath the skin, which helps to prevent patients from wrinkling and forming hollows and depressions in their face. It is very helpful for facial rejuvenation procedures because it gives a more youthful and pleasing appearance for the patients. Today, Kelly is going to work with us in allowing us to administer some hyaluronic acid to some of the areas of concern that she has on her face. The first area that I want to address is the tear trough area.